We're here today to honor the legacy of an organization called the Medical Center Clinics, which is kind of a name that doesn't really describe what this phenomenal group has done over the years. We're here to recognize 11 amazing individuals who have made such an impact over the years here at Shreveport. Let me just read out their names just so we can set the stage here. I'll read their names out and then what specialty they were associated with. Dr. Samuel Cummins, pathology. Dr. Edwin Earl Dilworth, obstetrics and gynecology. Dr. Edgar Hull, our first dean in internal medicine. Dr. Charles Knight Sr., surgery. Dr. Eric Lang, radiology. Dr. Dudley Isom, oral surgery. Dr. Thomas Norris II, orthopedics. Dr. Bert Trishell, urology. Dr. Herbert Tucker, cardiology. Dr. Clarence Webb, pediatrics, and Dr. James Woody Wilson with internal medicine. So that's why we're here today, is to unveil the Medical Center Clinic's legacy wall. But the reason we're doing that is because the Medical Center Clinics, those 11 founders, and the gentleman that followed after, have donated over $2 million to the graduate medical education program here at LSU Health Shreveport, making them the largest single benefactor of our residency programs. And so we thank them for all that they've done. We thank the original founders and all the board members who have followed since in helping us to be better.
I want to thank each and every one of you for being here. I want to thank you for the legacy that your relative has left this institution, because the individuals that we're here to celebrate today really were the backbone of this institution.
Sir William Osler essentially created the apprenticeship model from which we now see as graduate medical education that we follow today. And his lesson is still apropos today, that every patient you see is a lesson in much more than the malady from which he or she suffers. Origins of graduate medical education has been in Shreveport since 1946 and recently surpassed a training of over 5,000 residents and fellows. That is a major accomplishment. Thank you again to the Medical Center Clinics, as this fund allows us to keep a competitive edge in training with novel equipment, exam training modules for board certification exams, which are the measure of the quality of your training programs, and for the acquisition of unique and novel educational programs like simulators.
It had a sterling reputation as a place where medical school graduates could take what was learned in the classroom and from medical school preceptors and bring it to life in providing quality care for patients. Patient care was administered under the supervision of each of these chiefs of services, namely those we are memorializing today. Learned skills were validated in real life, and layered on top of that was the wisdom and practical application that each one of our founders was able to impart that could only come from their years of practice.
Are you ready?
Yes.